Good afternoon, and thank you all for being with us today. I'm Sarah Bentley, your host for today's talk, Understanding COVID-19 Vaccines. And before we begin, I have a few housekeeping items to go over. All microphones will be muted during the event. The event is being recorded and may be shared on social media and other platforms. If you do not want to be on camera, please turn your camera off and/or change your display name if you wish to remain anonymous. If at any time you have a question, please place your question in the chat box. We will have time allotted where we will answer submitted questions from the chat and address questions you submitted during registration. This is an overview of our program. I will be sharing more about the Lupus Foundation of America, some helpful resources and ways you can get involved. Then we will hear from Dr. Dean Xerras, a breakdown on the COVID-19 vaccines, how they work, how effective they are, what to expect if you get one. Then we will move into the Q&A where your questions and concerns about the COVID-19 vaccines will be addressed. And lastly, we will close with additional information, helpful resources, and a post-event survey where you can submit feedback about today's program. I will now share more about the Lupus Foundation of America, some resources and opportunities for you to get involved. People affected by lupus represent the heart and soul of our foundation, and you are the central focus of everything we do and are a constant reminder of our mission's urgency to serve to motivate us to continue this fight. We understand the emotional turmoil, economic hardships, and physical suffering caused by this disease. And because of you, we are motivated to work harder and faster to bring lupus under control so everyone can have a life free from lupus. To put this simply, our goal at the Lupus Foundation of America is to one day end the impact of lupus and its suffering, while ensuring that we provide a comprehensive support programs for people with lupus that they need today. Our programs stand on 3 pillars: research, care, and support services and advocacy. We have redefined lupus research to expand our efforts beyond just funding research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this while providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. Our approach is comprehensive and focused on achieving meaningful results that will make a difference in the lives of people affected by lupus. And to that end, we align our efforts and resources toward achieving 4 specific outcomes. Improve early diagnosis of lupus by increasing awareness of symptoms and educating health professionals so people with lupus get prompt care and treatment. Secure new, safe, effective, and tolerable treatments for lupus by advancing research, improving how new treatments are evaluated, and educating people about clinical trials. Expand direct services and increase access to treatments and care by providing resources and advocating for improved health services and affordable medicines. And raise money and secure government funding to operate programs that help people affected by lupus. Our research is patient-centered and focused on transforming lives. We have 3 goals: identify the causes of lupus, discover better ways to control symptoms, and ultimately find pathways to cure lupus. We seek to deliver the most significant impact on people's lives in the shortest time possible. And to do this, we must attack lupus from every direction, advocating for sustained funding for lupus research and education programs, funding research that will directly impact people's lives, and bringing together lupus experts from all areas: clinicians, researchers, pharmaceutical and biotechnology companies, and government agencies to deliver results. Today, our research efforts are transforming lives and bringing us closer to our vision of a life free from lupus. People with lupus are so important to the research process, and that's why we developed our new online research platform called RAY, Lupus Research Accelerated by You. We've made significant progress in lupus research, but we are far from over in our quest to solve this cruel mystery. And researchers need your help. You can help advance lupus research right from the comfort of your own home by participating in RAY. Share your experiences with lupus to help inform future clinical trials of new lupus treatments and identify the most pressing needs of people with lupus. No one understands lupus better than those living with it. So with Ray, you can compare your experiences with others, get updates on new research studies, share medication and health information with your doctor, help brighten the future of lupus research. I'd like to shift gears and share more about our programs and resources. To start, our National Resource Center on Lupus is your one-stop resource for all things lupus, from treatment to living and coping with the disease. It aims to ensure that everyone affected by lupus, including people diagnosed with lupus, caregivers, and healthcare professionals, all have access to high-quality resources that provide emotional support and clear, accurate health information. Our certified health education specialists are trained to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information to answer your questions about lupus and how to cope with it. And to contact a health educator, you can fill out our online form at lupus.org/health-educator or call them at our 1-800 number, which we will provide for you after this program. Take Charge is a 12-week education email series for people with lupus, including those recently diagnosed. And when you sign up, you'll get an email from our health education specialists with tips and resources that can empower you to take charge of your health. This series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most out of your doctor's appointments, just to name a few. We have so many other programs and resources available to you, including the Expert Series, which is our monthly educational podcast where our team interviews experts in the field about topics that are important to you. More than 150 support groups across the country where people with lupus can come together, ask questions, and listen to others, including a Boston-based peer-led support group. You can also join Lupus Connect, our online support community where members can engage with each other and ask questions. There are so many ways you can get involved to help fight to end lupus. One way is through Walk to End Lupus Now. So many of you have participated in one of our walks across the country and on the Boston Common. This year, we will be walking virtually again across the country as one community on 10/16/21. Make Your Mark is our community fundraising program. It's a way to turn any event into a fundraiser for lupus. Use your passion to raise funds for lupus through an in-person or virtual event. And Team Make Your Mark is a way for novice or experienced athletes to combine running, walking, triathlon events with fundraising to support lupus research and education programs. This year, we'll be hosting our virtual 6 challenge again from August 23rd to the 28th, where participants can complete 6 miles over 6 days, however they choose, to walk, bike, run, or swim. And finally, your voice is one of the most powerful tools we have. We are the leader in stimulating federal support for lupus, generating more than $615 million for lupus research and education in the past 5 years. Every day we fight to ensure the government is responsive to the needs of the 1.5 million Americans living with lupus, and you can sign up to be an advocate. You can find local support and connect with resources in your community through our network of chapters and regional offices that offer local programming like this, support, and events. And I'm your contact for the Boston, New England area, so please don't hesitate to reach out to me at bentley@lupus.org. Finally, here is more information on how you can reach out to us and follow us on social, which is a great way to stay up to date on all programs, events, and services that I've mentioned today. And with that, I thank you for listening to what we do. I'm now excited to share with you our featured speaker, Dr. Dean Xerras. Dean Xerras is a primary care physician and since 2009, medical director at MGH Chelsea Healthcare Center. An assistant professor of medicine, Harvard Medical School, he is also a co-investigator of the Mass General Brigham Engagement and Communications team of the NIH's All of Us research program, where 1 million people will share their health information and samples to build the largest, most diverse health database of its kind. He has devoted his career to community medicine with the hope of reducing disparities in healthcare delivery among underserved patient populations. And as I mentioned before, research is important and researchers need your help. That's why we're excited to partner with Dr. Xerras and the All of Us research program, because we share a common goal, and that is to help accelerate medical research. And now it's my pleasure to welcome Dr. Xerras, who is going to talk about the COVID-19 vaccines.
Thank you, Sarah. Everybody can hear me okay? I'm going to share my screen. That was a great introduction. It just reminds me about how important a community is and how powerful community is in everything we do. And you know, the Lupus Foundation of America, and for patients living with lupus, it's remarkable of all the things that you're doing and all the outreach and all the opportunities that are for patients living with lupus and other diseases. So hats off to you. Thank you so much for inviting me to sort of be part of this. Really exciting opportunity. I want to just kind of give a little background about myself. As you mentioned, I'm a primary care doctor first and foremost. I've been a PCP for about over 20 years at MGH in Chelsea. And, you know, that's sort of my first love. You know, I take care of patients, and, you know, I have been at the forefront of this pandemic in Chelsea. If people on this call are from Massachusetts, they're very familiar with Chelsea and how impacted it was by the COVID pandemic back in the first surge back in April of 2020. And I was on the front line seeing patients in our clinic with COVID, and seeing all the devastation that it was causing around, you know, early infection and inability really to know how to treat, and, you know, even inability to test. We were unable to test people early on in the disease that we knew had it, and that was very frustrating for us. So I'm very excited to be here to talk about the COVID-19 vaccines. Financial disclosures, I have none. So I do not work for Moderna. I do not work for Pfizer. I do not work for Johnson & Johnson. I do not work for any of the companies that pharmaceutical companies that make the immunomodulatory drugs or auto you know, immune drugs that people are on for lupus. So I have zero disclosures. I'm a PCP, and I talk to patients, and I understand vaccine hesitancy, and I understand healthcare hesitancy and many things. So I did receive a lot of questions that you had all put in during your registration. So I was hopefully able to incorporate that into my presentation. There's, you know, 1 or 2 slides based on those questions. So, you know, I certainly have a set of slides, and, you know, if I answer your questions, great, but we will certainly leave opportunity for questions at the end. And let me just look at my clock. So 12:16, I'm guessing I'll go till around 12:35. Is that okay with everybody? Perfect. So again, I'm medical director at MGH Chelsea. I'm an assistant professor of medicine at Harvard Medical School and co-investigator of the All of Us research program at Mass General Brigham. I'm a PCP, and this is my help for many people who are undecided about the COVID-19 vaccine. This is the purpose of this talk, is to help you understand the differences between the 3 vaccines that you've heard about, and how it might impact you and your health or your disease, a lupus. And there's a slide at the end that will walk through a little bit about, you know, well, what if I'm on this medicine? What does that mean for the vaccine and how I can get it or when I can get it? So I'm going to go to let's see here. So here's my attempt to do a live poll. So if you see at the top, it says Dean Xerras 021. If you have a phone and you have an ability to text, and you can text Dean Xerras 021 to the number 37607, it will give you a text back, and it will say that you've entered. And then after you're able to enter an answer, the question I have for you is, for those who have not received a COVID-19 vaccine yet, what are your plans? A, as soon as I'm eligible, I'll be first in line. B, no way, never. C, I'm undecided, hoping that this talk will help me with my decision. So again, if you have the ability to text, perfect, we see somebody answering already, so it's working. So 37607 would be the number that you're going to text to, and then you just text the phrase Dean Xerras 021. And A would be, as soon as I'm eligible, I'm going to be first in line. B, no way, I'm not getting it. C, I'm undecided, hoping this talk will help me with my decision. So we'll give a minute or so and see if people can do that. If you don't have the ability to text, you can also go to pollev.com/Dean Xerras 021 and also do that. vote that way. So it looks like people are able to do it. So I'm going to wait a little bit longer, get some. Yeah, Elizabeth put in the chat the actual link that you can click directly on your computer, and it should take you right into the voting poll. So I think there's about 20 of you on the talk, so we will give it a little bit more time. Again, for those joining late, if you text DNIC Xerras 021 to 37607, you will get a reply text that will say you're entered into the questionnaire, and then you actually will enter A, B, or C for your answer. And if you make a mistake, I think you can type in clear or undo or something like that if you would like to change your answer, but otherwise you're only allowed to vote once. So. I will give it 30 more seconds. We'll have plenty of time for questions at the end as well if your question is not answered during the presentation. So far you see, as soon as I'm eligible, I will be first in line, 77%, and 23% say I'm undecided, hoping this talk will help me with my decision. I think one of the saddest questions I read in the compilation that was sent to me was, I really am quite upset I haven't been able to get a good answer from my PCP or my rheumatologist, and I'm just really getting all of my information from the internet or TV. And that sort of made me sad because, as I said before, I'm a PCP, and that's my job. That's our job to really help people, move them along on the decision-making process. I'm not here to say you have to get the vaccine because that's what we need to do for the world and the country. We're here to give information and for you to understand the facts, evidence, and make an informed decision or an informed refusal. We need to make sure that information is there. So again, 77% said as soon as I'm eligible, I'll be first in line. I'm undecided, hoping this talk will help me, is about 23%. So we're split about 3/4 saying they're ready to get it. And we had another slide. Let's see. I'm going to stop share for a second and then go back because it didn't let me advance. If you want to, I don't know how successful this would be, but I'd like to know who received the vaccine already. If you could type into the chat that you've received it, yes or no. Yes, that means you've received it. No, that you're not. I'm just curious as to see how many people have already received the vaccine as well. Oh, I think, or is somebody's going to put up a poll, I think there, right? Was that you, Cheryl?
Yes, it is.
Great. For some reason I cannot advance these, so there it is. Excellent. So are we going to see that in the chat, or is there a separate survey? You want to walk us through that, Cheryl? It's fine if you kind of jump on and say that.
I'm going to end polling and you should see the results, right? Is everybody okay? I'm going to end polling. And do you?
Oh, there it is. Yeah. Yep. Have you gotten the COVID-19 vaccine? So, there's about, I think, close to 20 people on the presentation maybe or so. So 17 have responded, 7 said they have gotten it, and 10 said they have not gotten it. And that could be, clearly related to eligibility. And, I certainly have my opinion on that as to why, people living with lupus are not higher up on the list, but that's a whole other issue. But so it looks like 10 people have not gotten it and 7 people have. So that's great. So we will move on. I'll start my slideshow. Excellent. So again, welcome back to COVID. these are slides many of you have seen many times over the past several months. This one is from Johns Hopkins University, and it shows over the past, 12 months since COVID started. You can see early on in April where the first surge was. You can see, interestingly enough, how low the daily cases were compared to what they were back in November, December, and January. This was the first phase, the first surge.
I'm sorry, Dean, could you share
Yeah.
your screen? I don't see the slides.
Oh, you
Could you
don't?
share-
Oh, sorry. Yeah. Now?
Yes.
Sorry about that. That was, yeah. So this is the slide many people have seen over the past year. You can see here in April during the first surge, predominantly, the Northeast, right, where we all saw, inability to test people. We didn't know the treatments, which were good treatments or not. We're literally throwing everything at people, and we saw that over several months things went down. We saw the summertime. This is where Florida and the southern parts of the country started to see a surge, and then that sort of went down. And then November, December, January, the whole country sort of exploded with this surge that you all witnessed and experienced, and contributed to the 500,000 deaths in the United States. And then, luckily we saw in January, in February, a sort of a steady decline, and the healthcare community, the country was ecstatic about this decline. And then it sort of leveled off, and you see here, this is as of March 30th. So you see here that in the country there are certainly rising cases of daily cases of COVID-19, and there's about 70-ish thousand you can see here per day. And this is compared to the 250,000 cases that we were seeing in the winter months. So clearly better, but concern that there's this uptick in cases. And then you can compare that to the daily vaccine dose administration in the United States. You can see early on, mid-December, the first vaccine was given to that nurse, I believe, in New York City. Daily, this is the amount of daily vaccinations. And you can see now we're up to almost 3 million vaccines a day. With the turnover in administration, there was a commitment to vaccinate, 1 million people a day. We're exceeding that now, and this has taken a lot of coordination and effort based on federal response and coordination with the states and the local governments. But you can see that this line is going in the right direction, and it's sort of a race between these new cases that are cropping up and creeping up with the variants, perhaps, and with people sort of relaxed and letting their guards down in certain states that are sort of relaxing their restrictions. So it's a race. It's a race between getting more people vaccinated and curbing the fourth surge that we're sort of at the doorstep of. You can see here that 332 million people in the United States, about 96 million, almost 100 million people have received at least one dose. And from the slide before, you saw that there's 3 million a day getting vaccinated, whether that's the first or second dose or the only dose of Johnson & Johnson. We're moving along, and this is really exciting. And this is the key to getting through this and getting to the other side of this pandemic. And then 53 million have been fully vaccinated, and we'll go over later what that means exactly to be fully vaccinated. So I just wanted to show those sort of to lay the groundwork about vaccination, why it's important, why from a public health perspective it's important to continue the vaccination progress, because this virus is tricky, and it's mutating, and it's developing different ways to enter the body and wreak havoc. And the vaccines, we're learning, are actually effective against these mutations. So everybody knows a little bit about the names Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna have been the creators of what's called the messenger RNA vaccine, and Johnson & Johnson is the creator of the viral vector vaccine. So some of you may have heard of these types of vaccines. Some of you may have not. I hope to be able to kind of distill this down for everybody to understand the differences of these vaccines. So it's literally all about this spike. And you've seen this picture, probably hundreds of times over the past 12 months. And it's this spike here that really helps this virus, this coronavirus, get into the body. It sort of grabs onto, to the cells in the back of the nose and in the cells inside the mucous membranes. It enters into our cells and it does its damage. So it's this classic spike protein that you've all heard about that really is what drove the vaccine production to do what it did to create the vaccine. Messenger RNA, people are familiar a little bit with DNA and RNA. DNA is a code. It's a genetic code. It's what we're all built from. It's our code, DNA, and then what DNA does is it codes for RNA, and then RNA is sort of like a code that creates proteins, it creates things in our body, hormones, things that are needed. So DNA and RNA. What I think you'll probably learn from this that you might not have been aware of is that the Johnson & Johnson vaccine and the Pfizer, Moderna are more similar than you think. People think, oh, I don't want a messenger RNA vaccine. It's new. It's never been used before. You'll learn a little bit about the Johnson & Johnson, vaccine shortly, but we'll get to that in a second. Like all vaccines, COVID-19 messenger RNA vaccines have been tested and tested and tested vigorously before being authorized to use in the United States. Messenger RNA science has been around for close to a decade. We haven't seen a vaccine used yet like we have for COVID-19 and Pfizer and Moderna, but they've been studying this for close to a decade. They do not contain a live virus. They do not carry a risk of causing disease in the vaccinated person. The vaccine, the messenger RNA enters the body through the vaccine process, and it never enters the nucleus of the cell, does not affect or interact whatsoever with the person's DNA. And I'll explain a little bit as to why. If you think about it, you've heard all about the storage process for these messenger RNA viruses, right? They have to be extremely cold, like 70 to 80 degrees below zero. So, that's the Pfizer. The Moderna one is a little bit less, has to be in a freezer, but not as cold. They're built within lipid. Lipid is it's a fat molecule. So it's the messenger RNA is put inside a fat molecule, and then this has to be stored in 80 degree below zero weather. That's because this messenger RNA is so fragile that once it's exposed to heat, it degrades. It's like a Snapchat. You heard, I think it was the former CDC director, Thomas Frieden, who said, this is like Snapchat. Your body gets the messenger RNA, and once it's in our body, it's 98.6 degrees here, right? It's hot. It literally is going to degrade. So it needs to do its job quickly. And then once it does its job, which is to create and code for that spike protein, I'll get to that in a minute, it degrades, it goes away, it dies. I mean, it doesn't have any opportunity to enter into our own DNA. So, and hopefully that helps you understand. And it's this cold chain process that really hits home as to what that means. It's so unstable at temperatures, higher than 70 degrees below zero, that it will degrade and die. The messenger RNA will fall apart. So it has to get into the body, do its job really quickly, because our bodies are hot. That messenger RNA disintegrates, but the good work of that messenger RNA is already completed. So how do messenger RNA vaccines work? The messenger RNA is, like I said, put into a lipid fat molecule, put into the syringe, injected into our arms. From there, our cells in our body take up this messenger RNA, And this messenger RNA is a code. It's instructions. It's an instruction to make that spike protein. We're basically making just the spike protein of the coronavirus. And then our immune system, once it sees that spike protein as being foreign, our immune system starts to build, attack that protein, build antibodies in our system. The spike protein actually disintegrates. It's actually it's an engineered spike protein, right? From RNA, which has long since degraded in our bodies because it's too warm. The spike protein was created. Our body mounts an immune response. The spike protein goes away. And then our body has built up this immunity to actually fight a future attack by a real coronavirus. So does the vaccine change my DNA? No, it does not touch or change your DNA for the reasons I explained. Can the vaccine cause a COVID infection? No, the vaccine doesn't contain virus. It actually contains, like I said, the code for the spike protein. So, and that's not infectious. So it absolutely does not cause a COVID infection. So hopefully some people like to see a little graphic about what happens. You can see here, these are the antibodies. It sees the spike protein. Then your body, starts to make antibodies like this. And then someday when the real coronavirus enters the body, you see that here, these two little proteins here start to neutralize those spike proteins. It's all about that spike protein. Your body will fight off the actual real infection by neutralizing those spike proteins and not allowing the coronavirus to enter our body. So for Pfizer, Moderna, two different types, two different pharmaceutical companies that have created them. One needs to be colder than the other. One needs to be warmer. They're both 2 shots. We'll go over some differences later. But in terms of side effects, pain, redness, and swelling at the site of the injection are common. I received my vaccine back in December and January, and those were side effects. I had a very sore arm. It was probably one of the sorest arms I've had for a vaccine, and tetanus, as you know, can cause a pretty sore arm. It lasted probably 3 to 5 days, like most vaccines. I had no redness, I had no swelling, it was just pain. The fatigue, fever, headache, muscle pain, chills. These are all common side effects for most vaccinations. Vaccines cause your body and your immune system to work and to create immunity to a future threat of an infection. So it's not uncommon for that process to include inflammatory inflammation in your body, which is headache, muscle pain, chills, fever. You can see here the difference between Pfizer and Moderna, blue and yellow being pain. This slide was from a medical student out at the David Geffen School of Medicine at UCLA with a former colleague of mine, Dr. Folomé. She wanted me to give credit to the medical student because medical students are amazing, and she drew this slide for us to share. But you can see the difference between Moderna and Pfizer for the rates of these side effects. So, what's great about this is that not everybody gets the side effects. Some people get them more than others. Some people get them not at all. I got more side effects during my second Pfizer vaccine, where for about a day I was sort of sleepy and didn't want to get out of bed, and I had a low-grade temperature. That's, a trade-off for the fact that I knew my body was working and building up an immune response to COVID and COVID-19. So let me move on here. So, the next one, viral vector. So we talked a little bit about messenger RNA vaccines. Hopefully you understand them a little bit better now. Viral vector vaccines have been around for 20 or 30 years. And these are essentially vaccines that use a virus, an adenovirus, which is a common virus that they render it inactive. They genetically make this virus so it can't replicate in your body, but they take this tiny little virus and they put in the code that's needed for your body to create an immune system. And so what I wanted to say here is that, it's a little bit similar to the science behind mRNA vaccines, because they essentially, it's all about that spike protein. They take the DNA from a spike protein, DNA, right, which is the precursor of RNA. So they take DNA and they put that into the viral vector, the Johnson & Johnson vaccine. And, this vaccine, again, uses genetic code, it puts it into the virus, this virus that's going to go in our body, puts it into the syringe. It doesn't contain the virus, the COVID-19 virus. It actually contains a whole other virus, but it's the vehicle, it's the vector. And through that, it gets into our arm, gets into the cells. It releases the DNA into the cells, but that DNA does not go into our own DNA. It goes into the nucleus of the cell, and then that causes a chain reaction of creating that spike protein, codes for that spike protein. And again, the same thing happens. That spike protein gets developed in our bodies. Our bodies see that spike protein as foreign. Our bodies respond and create antibodies to it. That spike protein degrades, goes away. That DNA goes away. And we're left with our body's response, built an immune response to COVID-19 and the coronavirus for when the real virus hits us. So again, viral vector vaccines have been rigorously tested again for safety, before being authorized to or approved for use in the US. They've used these for decades, and most recently around Ebola outbreaks in Africa. They use a modified version of a different virus. As I said, it's called an adenovirus to deliver the instructions, to deliver the genetic material. In this case, it's DNA, it's not RNA. And it does not cause infection with COVID-19. The genetic material does not integrate into our own DNA. And again, it starts the process to code for this spike protein, which once our body sees this spike protein, it thinks it's foreign, and then we build an immune response to that. That immunity stays in our system. We're seeing now, Pfizer reported, at least 6 months, which is exciting. We're seeing that the amount of immunity that we get to these vaccines stays longer than we had originally anticipated, and perhaps even longer than that. These are all parts of research that are studying the people that were vaccinated early on, and they're seeing even now 6 months later, there's still antibodies to that spike protein. So when our bodies get exposed to a actual coronavirus with a true spike protein, our bodies know what to do with it. So here's generally just the differences between, the viral vector and the RNA. Again, Johnson & Johnson teaches the immune system to attack the protein virus. The instructions are carried by a non-dangerous virus. In that case, it's an adenovirus. And in the case of Pfizer and Moderna, it's the actual RNA. There's no virus attached to it. It's the RNA itself put into a fat molecule sent into our bodies to do that kind of coding, and then disappearing. What's left is our body's immunity that's been built to fight a future attack by coronavirus. You can see here all of the numbers that you've heard about, right? Johnson & Johnson effectiveness is 66%, Pfizer and Moderna 94 and 95%. Remember, research, has been boring some of these details out. What does it mean to be 95% versus 66%? Pfizer and Moderna were not being tested during some of the variant phases, so Johnson & Johnson was. So maybe their rates of efficacy are lower because of that fact, which is a good thing, because what Johnson & Johnson also showed in research is that there's zero hospitalizations from severe illness. So at the end of the day, we want these vaccines to prevent death. I mean, as a doctor, as a PCP, I don't want people dying from COVID-19 anymore. They shouldn't be. So if we can prevent death and severe illness, that's successful. Johnson & Johnson does that. Pfizer and Moderna, were studied differently, and I'm not here to explain the details of each clinical trial, but but they are highly effective in preventing severe disease as well. We're even learning now that some of these, vaccines are able to prevent the transmission of the virus, which is also an excellent point because in addition to preventing severe illness, we don't want this virus to be carried from one person who has been vaccinated to somebody else who perhaps might not have been vaccinated. The storage conditions you can see here, very, very cold for Pfizer, and how long they can last once they're open. Those are a couple of things that might determine where, which vaccine is important for which clinic. If we're vaccinating, a population that might be transient, like a homeless population, we might want to just consider doing, a one shot with Johnson & Johnson, because we may not see them, regularly or back at the timed, second dose that Pfizer and Moderna require. Again, Johnson & Johnson is one shot, so there's some benefits to that. Pfizer and Moderna, 2 shots. With Pfizer, it's 3 weeks apart. With Moderna, it's 4 weeks apart. They're all FDA authorized at this point. So that's hopefully a little bit of a picture as to why. Let me sort of summarize here. So how do you decide, right? That's really important. Shared decision-making process with your rheumatologist, with your PCP is critical. I have these conversations with my patients all the time. I'm not here to say you need to get this vaccine. I'd like everybody to get vaccinated, but it has to be a right decision for you. Patients should receive the vaccine consistent with the CDC mass DPH recommendations. I put an asterisk there because, as soon as it's recommended, it should have been recommended, I think, for patients who are on immunomodulatory medications, who are on autoimmune, who have autoimmune disease, who are on immune suppressives, right? Clearly, we think that's important. For some reason, it's just patients who have had immunosuppression for solid organ transplants. There should be no preference for which vaccine you get, unless you have an allergy to a component of the vaccine. You're able to receive any one of them. And a vaccine allergy would be to a specific ingredient of the vaccine. It's called polyethylene glycol for the Moderna and the Pfizer. There's much less allergic reactions to Johnson & Johnson because of its use for many, many years and because it's used in a viral vector. So that's one difference. And there may be a blunted response to the vaccine in patients with autoimmune and inflammatory, rheumatic disease. These patients, many of you on this call, you are on immunomodulatory therapies. So because of those therapies, and because those therapies reduce, immunity, they may reduce the response that you get to the vaccine coming into your system. So I think here's just, if people had questions about their specific treatment, no modifications to therapy or vaccine timing would be the medications on the left. And on the right would be medications which may need therapy, changes to therapy or vaccine timing. And the ones that I've highlighted and put in underline are some of the more common medications I believe that people take for systemic lupus erythematosus. So, and so if you see your medication or your treatment on there, this would be an opportunity for you to have that discussion with your rheumatologist as to when. But again, the consensus from the Academy, the Rheumatoid Foundation, ACR, is that you should get the vaccine. This is something that if unless there's a contraindication because of an allergy, there might be something related to timing of when you get it, of when you get your rituximab infusion, and you need to wait a couple of weeks before that's over in order to get your vaccine. But the bottom line is that you are eligible and you should receive it because we want to protect patients with chronic diseases like SLE. So after you're fully vaccinated means 2 weeks after the second shot in a 2-dose series like Pfizer or Moderna, or 2 weeks after a single shot like in the Johnson & Johnson vaccine. And so once you're fully vaccinated, people still need to continue to, take precautions. This is not a free ride. There's still studies going on around how efficacious they are, if they're, lead to infection despite being vaccinated, as I mentioned. And the good news is that we're thinking that they are heading toward, preventing infection, even though you're vaccinated, which is great news. But wearing masks, continuing to physical distance, adhere to other prevention measures when visiting unvaccinated people who might be at an increased risk for severe COVID-19 disease. Wear your masks, maintain physical distance, avoid medium and large sized in-person gatherings, get tested, right? I mean, I've been vaccinated for 3 months. If I have symptoms, I still need to get tested. There's still a chance. Vaccines don't always work. But we know that they work very well. But if you still have symptoms, you should be tested. Follow the guidance of your employer. Follow the CDC and health department travel requirements and recommendations, which is some good news, right? So we see here that just came out, you can travel if you're vaccinated without a pre or post test, without quarantining after travel is just come out yesterday by the CDC. You may be able to travel internationally without pre-travel test, depending on your destination. You can be inside your house with other members of your friends and family who have been vaccinated without wearing a mask, which is exciting, I think, right? You can visit inside a home or private setting without a mask with unvaccinated people who are not at risk for severe illness. So you can see here, there's some great benefits to being vaccinated and being fully vaccinated. Again, it's 2 weeks after that second shot or 2 weeks after the first shot. So, everything about what we do in medicine is learned from research. And, luckily, we're able to study the effects of this vaccine. I know somebody asked in the registration comments about have there been studies on lupus patients with this vaccine? And no, not to my knowledge. And I'm sure there are ongoing research around the vaccine and stratifying patients with chronic diseases and immunosuppressed patients. But the key here is to become part of research for other things as well. And I know people living with chronic diseases, are very interested in learning more about that. And for some of you who are part of the All of Us Research Program, thank you. For those who are interested in becoming part of the All of Us Research Program, we'll leave this slide up there in a minute. I wanted to say thanks. I know we have about 10 minutes for questions. This is where I want to be when I'm fully vaccinated. I have plans to travel in the summer. I think getting back to being outdoors with people that we love is key. So I wanted to thank you for your attention. I will leave this slide up if anybody wants to take a photo of the QR code. And thank you again for your attention, and have a great day.
Thank you so much, Dr. Xerras. That was fantastic. Yes, if you'd like to learn more about the All of Us Research Program, please keep that up. We'll also put a link in the chat box, I believe. But we do have a question that's come up, and I know I think we should just address it right away,
Sure.
as it has come up in many conversations as well, about the Hopkins study. Nancy wrote in the chat box that she has her daughter participating in the John Hopkins study of transplant recipients who have been vaccinated. So what are your thoughts on the results?
In medicine, I have to say I have to admit that I don't know something. So I'm not familiar yet with that study. If you want to come off mute and actually say something and ask me what you've learned, and maybe that will help me kind of joggle my memory.
Sure. Can you hear me now?
I can, yeah, thank you.
Okay, hi, thanks for addressing the question. I believe that their preliminary results have shown that I believe it's about 17% of folks who received their first vaccination shot, in the 2-dose schedule.
Yeah.
It was only 17% that showed antibodies after that. And I know a lot of the participants were pretty discouraged about that, and they're waiting to hear back about results from after the second shot. And my own daughter did get the second shot and waited a month and still had no antibodies. So it's hard to hear that. And the study folks have explained that antibodies are not the entire response to the vaccine, but it seems to me that it sounds like they can't really tell you what the B cells or T cells in your body have learned or are capable of doing in fighting the infection afterwards?
Yeah, no, that's a great question. Is your daughter in the trial?
Yes,
And is it for Pfizer or Moderna? Did you mention that?
it was both.
Sure.
They looked at both.
They did.
Yeah.
Yeah, I mean, we certainly, do get discouraged by information like that. And, there's B cell, immunity and T cell immunity. The B cell immunity are the antibodies, and that's certainly what's measurable. And, I know that the T cell part of this is, what's not measurable, and what, we think that even after the B cells wane or disappear, that months or years later, the T cell response could be what also wakes up and recognizes, a foreign host and is able to kind of fight the infection. So, I don't hang my hat on preliminary data, as a PCP and as a scientist. I agree it's discouraging, but there are many other ways to for the immune system to work, and this T cell one is the big one. And I know that after the first shot, after the first shot, you have some protection and some immunity, but it's that second shot that really does kind of kick that immune system into overdrive and create, the more robust immunity. But again, I haven't read the study, and, so I can't comment completely on that, but I still am, a scientist, right? So I do follow the science, listen to the evidence, and I try not to question it, but I'm also hopeful in that, there could be some other confounding variable there that they haven't determined or uncovered that might explain what they found in at least the quantitative part of it, the measuring of that antibody, and then the sort of the whole qualitative piece of, like, how that works to fight infection is a little bit different. I don't know if that answers your question or not, but
I appreciate your help with that. Thank you. Yeah.
sure.
We'll see how it comes out with
Yeah.
the further looks they're taking at things.
Yeah, I agree. Thank you.
Thank you.
Yeah, just also in general with lupus, do those with lupus have less immunity with the vaccine because of their suppressed immune system? I think that kind of goes back to what you were just was also saying as well.
Sorry, I just did something to my screen. I think I get this one up here. So ask that question again. I'm sorry, Sarah.
Yeah, they're just in general with lupus, do
Yeah.
those with lupus have less immunity with the vaccine because of the suppressed immune system? This is a general question as well. It comes up a lot.
Right. So obviously, if you're on an immunosuppressive, I mean, that's where some of these, the slide I showed about timing for the vaccine, because yeah, I mean, and there's really no consensus on high doses of steroids, right? So I think, in the slide, I pulled this from the ACR guidelines that, you see that less than 20 milligrams per day of prednisone, there's no modifications to therapy or vaccine timing. At higher doses, it's sort of it's not as, the strength of their recommendation is not there. So, it is possible that the medications that you're on for your disease are suppressing your immune system to allow you not to mount that response for the vaccine. So that's why, if there are trials ongoing around, patients, which I'm sure there are, that are on immunosuppressives, whether you have lupus and are on an immunosuppressive or something else, these are where we're going to learn all of our information. And that's where I do feel strongly about research. If you're able to be part of it, that would be very helpful. But I think the consensus is strong from the American Academy of Rheumatology that you still should get the vaccine, and that unless there's an allergy to a component of the vaccine, that the benefits clearly outweigh any of the risks, which, in the case of risks, there's some of these mild side effects.
There's a question about trials for kids 12 to 16 years old that's ended. And then when do you think the vaccine will be approved and available?
For children?
Yes.
Yeah, so I think, we are actually at MGH Chelsea enrolling patients in a trial for, I believe it's Pfizer. So they're absolutely still ongoing. I think, what I've heard probably just as much as you all within news and Dr. Fauci and Rochelle Walensky, who's the director of the CDC, who was a former colleague of mine at MGH, and hopefully in the next couple of months, I think we're going to have some emergency use authorization for children. So I'm excited and hopeful about that. But the trials are still ongoing.
Thank you. And then yes, back to the previous question, I also wanted to share that we also helped in conducting a global online survey focusing on the impact of COVID-19 pandemic on people with lupus that understand views of the vaccine as well. That's the World Lupus Federation. I have a link for that as well later.
There are 2 questions in the chat. What are your thoughts on the pausing of the AstraZeneca vaccine in some countries?
Yeah, I there were some side effects that they were experiencing. I mean, it happened earlier on, I think, with Moderna, and with some kind of crazy bad, diseases or reactions. And I do know that, after further investigation, it was found to not be a link. So again, I know how troubling it can be to see that and to say, hey, am I going to be getting my vaccine next week, even though they're pausing the vaccine trial, for this reason. And, I think getting information is key. And so obviously I don't have the details behind why they paused it or whether I believe they restarted it. But, a lot of times it's not related to the vaccine, and, they're able to determine that. And I have faith and trust in scientists, and to be able to say that after they take a closer look at what might have caused the pause.
So in general, how likely are you, the listeners, likely to take the vaccine now after hearing this presentation? You can throw that in the chat or unmute. We have a poll going.
Great.
We have 9 responses, 8 say likely, 1 still considering, 2 still considering. And then also, there's a question that just popped up. Is it safe for us to be with unvaccinated kids?
If you're vaccinated or if you are unvaccinated?
If you're vaccinated, thank you.
So if you are vaccinated, if it's somebody that's not within your household, you should be still wearing a mask, and protecting yourself. And in large groups, obviously, even if you're vaccinated, you should be wearing a mask, in groups, and we assume that kids will be in groups. Getting vaccinated is key, but it doesn't sort of, it doesn't, alleviate those other important steps at kind of preventing, infection, because there, again, studies might show that some people don't mount the response. You could be vaccinated, you got your card that says you're vaccinated, but, there may be something with your immune response, whether it's based on your lupus diagnosis or whether it's based on the medicines you're taking for your lupus, that haven't created that immune response that's going to protect you. So I think until we know those from further studies, that's why we're telling people you still need to wear your mask after you're vaccinated, certainly among strangers and groups.
Yes, this was for someone who they are vaccinated, but they're curious about, is it safe for that person to be with unvaccinated kids in the same household? Or what would be some precautions or thoughts around that?
Yes, no. So if you're vaccinated in the house, you are protected. If this is your pod, you sort of control somewhat as to, who's coming and going inside of your home. So within a home, if you're vaccinated, you can be without a mask. And obviously if you're having symptoms, you need to be tested. If your kids are in school, my kids are getting pool tested, so we're, feeling safe. I mean, I'm vaccinated. I have a 12-year-old and a couple of teenagers, and I know they're in school, and, when you're vaccinated, you are protected. Hopefully, right? I know that I don't want to cast doubt into whether the vaccine works, but of course, with the questions I've been asked today, there's certainly a possibility that your immune response might not have taken the vaccine, the antibody level might not be to the level that it needs to be to fight the infection.
Oh, there's one more. We'll just take this one last one
Sure.
because of time, and then we will wrap up. Is there any difference between those who already got COVID and got the vaccine after several months and those who never got the virus and get vaccinated as far as the side effects?
I mean, we've been hearing anecdotally that people that had the disease that got vaccinated might have had more of an inflammatory response. At least that's what I've heard from some people who I've known, patients that have had it. So that could be there, because there obviously is still some immunity from the native infection, from the actual natural infection that they had. But again, the side effects, if I haven't been clear, I want to be clear that the side effects are short-lived, they're mild, maybe a day or two of some muscle aches, chills, and maybe a low-grade fever. I had a temperature of 100.0 the day after my second Pfizer shot. I timed my vaccine on a weekend, so I didn't have to lose work. I probably could have worked even with those kind of muscle aches. I took some Motrin. I felt much better with the Motrin. So the side effects are short-lived and relatively mild. And you're going to hear people say the second vaccine side effects are worse, or I had COVID and they were worse, or I didn't have COVID and they were worse after the vaccine. We're studying all of this. These are going to be things that come out of some of these trials around vaccination. So we'll hopefully learn a lot more. And whether we need a booster in 6 months or a year, these are all things that we're going to learn about.
Great. And then I did miss another part of the question. Is it possible to be a COVID long hauler if you catch the milder form of COVID after vaccination?
Again, these are incredible questions. You're seeing a lot about being COVID, long haulers, and we don't know much yet about what constitutes being a COVID long hauler. Who is more at risk for that? Who is more at risk for these symptoms that linger? Is it somebody who had a mild form of disease? Is it somebody who had a severe form of disease? Is it, does it get better, if you're a long hauler and you get vaccinated? We've seen reports about that. So this is what, scientists are craving, people to join research, to be part of studies that actually look at that. And so we can make really evidence-based decisions and recommendations on the facts rather than anecdotes.
Well, again, I just want to remind you that this was recorded, and we will be following up with an email with the recording and some resources and links for you as well. And don't hesitate to reach out and respond with any additional questions. And we'll also have a post-event survey that we'll be sharing so that we can get feedback to help us with future events. And with that, if there's anything else, I think that will close our program for today. And I want to thank Dr. Xerras and the All of Us program, and for having me as your host today with the Lupus Foundation of America.
I want to say thank you, everybody, as well. Thank you, Sarah. Thanks for having me here. And feel free to kind of reach out. I'm happy to kind of field questions later. The team here can send them to me, and I'll try to get back to you. I'm happy to do that.
Great, wonderful. And we also do have a local Boston-based support group for you as well, led by Kelly Keefe and Don Peters. Here is an email. They're called lupuslightsnewengland@gmail.com, where you can email them for more information to connect peer-to-peer as well in your community. Thank you,
everyone. Happy Easter to those who celebrate. Happy Passover. Take care.